Thanks so much, Louise, and hello everyone again. So I suppose one of the main things I want to start by saying is that this is a fellowship that really helps to give you the time to solve a problem, and a problem that is important to you using digital. So I think when I go back to why I ended up applying for the Topol Fellowship to begin with, I had recently started in the trust that I work in and was working specifically around physical health and trying to make sure that we were really able to evidence the good care that we were giving our patients. But I found that a real struggle with our EPR system, and I couldn't really find what I needed to find. So I delivered a small digital project in my trust, and I was approached and advised, this could be even bigger. You could really learn some new skills and help to the leveling up agenda in mental health, and help to deliver on some of those key things that we need to improve mental health and to use digital to support it. And I must admit, applying was the best thing that I ever did. One of the interesting things that I've learned, the project that I started with, the project that I went to Louise and everyone else with, is not the project that I'm actually ending with. So what Topol has helped me do is follow the evidence and follow the data. So I originally wanted to sort of implement a risk stratification tool into our EPR system so that, we could predict risk of diabetes for our SMI patients. But what I found in my learning and discovery was that actually that kind of was going to fail without doing some of the beginning work around supporting staff around change, and supporting staff to have the skills and competencies to be able to use new technology that comes in and use new tools, and to navigate through all the different systems that we have within mental health. So I ended up meeting Henrietta and now doing a piece of work around skills and capability frameworks specifically for mental health. And I think what I've learned from this is it's given me the confidence to look more widely at a problem. So not to be so focused on, right, well, this is the problem, we know what the solution is, and jumping straight to the solution. What it's helped me to do is to look more widely, to test assumptions, to follow where the data goes, and not be scared of having difficult conversations or having to, in what some people might think, take steps backwards to make sure that a project is going to succeed. It really helps you in this agile working and QI methodology to really focus down on testing your assumptions and working with and following the data. I certainly would recommend this for mental health. A lot of us are just mental health trusts are just at the beginning of our digital journey, and there's a lot of leveling up to do, and there's a lot of investment coming our way, and it's a real chance to get in at the beginning and to help shape that digital future for mental health. Because I think when I think about the patients that we want to reach, there is so much we need to consider. Digital inequalities. We need to think about how to engage our staff engage our patients safely in using new technology and remote monitoring in a way that is reflective and considered in their care, especially when we think of how we used to work pre-COVID, where mental health is about that face-to-face, that therapeutic relationship. So how do we translate that in a digital way? So there's lots of exciting things that can be done, and this is a great way of giving you the resource and the time to explore that and make some real meaningful change within your trust.